Now we're live. Hi, everybody. Welcome to today's panel discussion with our experts. The topic of today is managing hot flashes using during menopause using a digital CBT based program. And my name is Sanjana, and I'm one of the founders of Miyara along with Gayatri. And Miyara is a digital platform that supports women through perimenopause, menopause, and beyond. And through our self paced programs, education, and awareness. And we are very excited to be talking about CBT, cognitive behavioral based therapy, and how it can be implemented for hot flashes today. This is a well studied technique. There have been a lot of papers published on CBT for hot flashes by Professor Myra Hunter and team. So let's just get straight into it. And first of all, introduce our panelists for today. We have Dr. Sukhpreet Patel, who is an OBGYN, menopause advocate, and founder of Menopause Wise. If you haven't seen her already on Instagram or YouTube, please do check out her page. We have Dr. Nivedita Sudheer, who's a consultant psychiatrist at TherepHeal, who's also trained from CMC Vellore and Nimhans Bangalore. We have Angana Mukherjee, who's a clinical psychologist, also works with TherepHeal, our partners who have helped us develop this program. And I hope we have somewhere Dr. Ananya Sinha, who is also the founder and director and chief clinical psychologist of TherepHeal, but I'm not able to see her at the back end now. Let me see. Yeah, and we have Gayatri also here today. Gayatri is my co-founder, chemical engineer from IIT Madras, PhD in bioengineering, and yeah, we're here together to talk about these aspect. So, welcome all of you. First of all, yeah. So, so let's start off with a question for Dr. Sukhpreet. Um, One of the questions that I have for you is, first of all, let's set the stage, right? So what exactly are we here to talk about? What is menopause, and what do you mean by hot flashes, night sweats, and what treatments are available to women right now?
Thank you. Thank you, Sanjana and Gayatri, for hosting this and for inviting me on this. I think you're doing a great job with women's health. So, thank you for that. What is menopause? So, if we go by definition, menopause is technically just one day in a woman's life, 12 months from her final menstrual period. That is, if I am 48 and I've had my final menstrual period on 1st of February 2024, then on 1st of February 2025, I will hit that line. I will be now technically in menopause. Everything before that is everything after that is post. But menopause for most of us signifies not just this one day, but it signifies a transition where a woman's ovarian function is beginning to decline, and her hormones, because of her ovarian function are also beginning to decline. So we'll see a reduction in estrogen, progesterone, testosterone, and the impact of this decline on her health, her brain, and many symptoms. Every cell of the body will get impacted at some stage, and hot flashes is one of the symptoms that she will experience or may experience because of a decline in estrogen. I think the next question was, what is a hot
What
flash?
are hot flashes in? Yeah.
So, hot flashes have been typically described by many women, and the common description is this feeling of immense heat, which rapidly occurs in the upper body, mainly face, chest, hands, arms. So, it is this sudden dissipation of heat. So, you start suddenly it comes out of nowhere, 30 to 60 to 90 seconds. You start feeling hot, and it's accompanied by a flush. That's why it's called a hot flash or flush. So it's redness, and then there can be sweating, there can be shivering after that sweating because of that whole cold response. You sweat and you're cold after that. Um, a night sweat is simply a hot flash that occurs at night in your sleep. So basically, it is the same thing, but it is immensely disruptive because it can prevent you from falling asleep. It can wake you up from your sleep. And lack of sleep can make you a really ugly person the next morning. And I don't mean to say physically ugly, you can just be like really in a bad, and that has its own health consequences. So that's night sweats and hot flashes.
So as you just described, it can make a woman feel really icky while sweating, and then suddenly cooling, especially if you're in a public place, or wherever you are, at work or at home or in a market or wherever. So I mean, it can be quite disruptive to a person's life for sure. So a question for you now, Dr. Nivedita, and thank you, Dr. Ananya, for joining us. We had some technical difficulties. Dr. Nivedita, so from psychological point of view, right? We know that menopause is a life stage, and Dr. Sukhpreet nicely described it. So, but what do you think are the what's happening in a woman's life in midlife and menopause from the psychological perspective? And how are these symptoms, like this physical symptom like hot flash, how they connected to your mind, and how is the mind body connection, if you can explain that a bit.
Right. Thank you, Team Miyara, for having me. Um, so to begin with, I'll take your question in two parts. So what is the psychological aspect behind menopause, right? So I think for many of us, while the stopping of the menstrual period can be met with somewhat of a relief, it's a little more complex. For some people, the change in a person's fertility may assure a complex set of emotions. Typically, menopause happens somewhere between 45 and 55. That's like the range usually. But there can be instances when a person is experiencing it sooner. There are reports of early menopause and so on. And today, what we're also seeing is a lot of women who are trying to extend their fertility, the period of fertility. So menopause is a lot more complex today in that sense, right? And essentially, like what Dr. Patel said, this is a period of transition, and it occurs both at biological as well as at a social level. And she described very beautifully what the biological changes that happen in a person's body are, right? But at a psychological let's look at it from a social perspective, right? This is typically when children are leaving home, there are career transitions, there are transitions in the body, in an individual's body image, transitions in a relationship with the partner, in their experience of sexual activity, and so on. So this is a process. It's a journey, right? So although medically we define it in terms of a day, but it's really a journey that a person has to go through. So it's far more nuanced than just some hormonal changes that are happening in the body, and
Yeah.
therefore it comes with its own unique set of psychological challenges. From a psychiatrist perspective, I think most often depression, anxiety, especially health related anxiety, is something a lot of women experience during this phase. In women with pre-existing mental health conditions, this period may also trigger these conditions may be triggered once again. Right? So uh, these are all challenges that are more specific or particular to menopause, like with any other transition. So, be it puberty, be it marriage, be it a significant change that's happening in body, in a person's social environment or in the biological milieu, all of these can act as triggers for psychiatric illnesses, um, of all kinds. So that is why menopause is important from a psychiatric perspective. Now, coming to the next question about mind-body relationship. So, simply put, the mind and body are a give and take relationship. So, think of it as two neighbors who live side by side. What one does influences the other. right? So i'm sure we've all had this feeling of butterflies in the stomach, which is typically what, some little bit of nerves that everybody experiences before, you say you go and speak in front of a number of people or something like that. We've all experienced that, right? So at that point, although the physical sensation is somewhere happening in the region of your chest or your abdomen, it's really something that's going on in the mind that's dictating that, right?
Yeah.
So this is how the mind works on the body. Um, so mind body relationship also works the other way around, where you can have your body influence your mind. So that is also some wherein a lot of our mind body exercises come in, so, say yoga, meditation, and so on. So you can that theoretically, by relaxing your body, send converse signals to your brain saying, look, the body is relaxed. And that is fundamentally not compatible with a anxious or a tense state of mind. So by what I'm trying to say is, by relaxing your body, you can also get your mind to relax.
Yeah, exactly.
So that is how the mind and body sort of communicate with each other, and this complex interplay is what is called the mind body relationship.
Yeah, thank you for explaining that. And as you can, as everyone in this panel can imagine, and everybody listening, that during menopause transition, every single cell of your body is kind of, affected from your brain to your toes, as some doctors say, because it is a mind body. Everything is, inflamed, or in working a lot. So thanks for explaining that. Getting to like the topic of today, right? We came here to talk about cognitive behavior therapy and understand from the experts who are unfamiliar what it is, what is mind body relationship, but what exactly is cognitive behavior therapy, and would love to hear how that can relate to different conditions, different symptoms, and in this case menopause symptoms. So would like to start with you, Dr. Ananya, and then Angana, Mukherjee, please join in.
Thank you, Sanjana. First of all, I would like to thank Miyara for organizing this talk. We don't often get to hear about hot flashes and CBT in hot flashes. That itself is such a unique combination, and also for ideating this entire program. And thank you for making TherepHeal a part of your journey. So, congratulations to the Miyara team for launching such a unique program. And on this note, I think when Nivedita was talking about mind body relationship, that is the cornerstone of CBT. If we understand this, that for example, she gave a lot of examples, and I think we all resonate with them. I resonate a lot with, like, when you have fever, you don't feel like doing anything, you feel very lethargic. So physiologically, it's affecting. At the same time, your thoughts are also affected. The way you're feeling is affected. And that is the foundation of cognitive behavior therapy. Cognitive behavior therapy is extensively used in anxiety and depression. And it's a very structured here and now approach. That's the crux of it. So we are not going into the past of something that you might have experienced in your childhood. Of course, early experience impact the way your beliefs are formed. So it's only at a conceptual level that we talk about it. But we are actually hitting the symptoms here and now and not getting into the past of it. The main way of understanding it is your thoughts, feelings, and behavior are all interconnected. So it's like, two-sided arrows. The way you think impact the way you feel, impacts the way you behave. Just to describe with an example, let's say you've gone to a party and you see a friend and you say hello, and you're waving at the friend, and the friend doesn't really look back at you and just, goes out of the room in a hurry. Now, in this situation, one interpretation of the event can be that, oh, she doesn't want to talk to me. Maybe she's upset and angry with me. I
Mm-hmm.
must have done something terrible, or I don't know why she's ignoring me. So, if this is your thought process, your feeling will be that of either anxiety, that what did I do wrong, guilt, or sometimes sadness, I'm losing a friend. And your behavior is basically the action that we take corresponding to the thoughts and feelings that we have. That can be more in terms of, okay, I will also not call her if she wants that space, I'll give her the space, it's okay. But in the similar situation, if we interpret it like, oh, what was wrong with her? Why did I was waving at her? She didn't notice me. I hope everything is fine with her.
Yeah.
So if that is the
Absolutely.
interpretation, then the
Yeah.
feeling will be that of concern, not guilt,
Absolutely.
not sadness, concern. And then your behavior will be, you'll probably send a message saying, I saw you in the party, you seemed a bit hassled, didn't notice me, I hope everything is fine. So,
Yeah.
this is a very simple day to day example to explain how our thoughts, feelings, and behavior are related.
Yeah.
And in this, link of three things, the other thing is also the physiological reactions that we have, the bodily reactions, which Nivedita was talking about.
Yeah.
So the entire CBT is based on this particular understanding. Now, when we are talking about the program that has been developed, we are using some CBT techniques
Mhm.
which can be used at a self-help basis. So you can yourself adopt and you can do, you can understand what is happening. So here, as the term suggests, one is cognition, one is behavior. So we are trying to see that, okay, let's first conceptualize hot flashes
Yeah.
from a psychological perspective. So it's again completely agreeing with Nivedita. It's a journey and it has many facets. It is
Yeah.
not just like, hot flash is one symptom, I take a pill and it's done.
Yeah.
It is an experience in itself. Every day it's a new experience. I think my hot flash experience today will be different from what I'm going to experience tomorrow.
Yeah.
And with every experience, there will be an accompaniment of thoughts. That
Yeah.
what am I making out of it? Sometimes people might think, my life is gone. This is how it is going to be. I'm going to be this old lady who's going to sweat in meetings and people are going to laugh at her. And the next day it can be like, oh my God, I'm losing my youth, losing everything, everything is going to go away from me, people are going to run away from me. So you
Yeah.
can see that even by the examples, some of the things are quite intense, sometimes catastrophic also. But
Yes.
when you are experiencing the hot flashes, they don't look and sound like catastrophic. They seem very logical
Yeah.
because you feel that only I know what I'm going through. Nobody else will understand how intense this experience is.
Yeah.
So, the entire program is based on first, for example, we have actually made a module of psychoeducation because we really wanted to talk about what hot flashes are, what menopause is. I remember when you approached us first about this program, I was thinking, what is this perimenopause? I always heard of menopause, but what does this mean? Am I perimenopausal? What? So I could see that even being in this field, there are so many questions that we don't know an
No.
answer for. So
Exactly. And I think this coming together of this particular panel with us, Gayatri and me as the scientists and gynecologists, psychiatrists and clinical psychologists, I've never seen this happen. So I'm
yeah.
extremely excited that we can come together and talk about this and create something for this. Yeah,
Absolutely, absolutely. I think that's what we are shifting also in terms of understanding a symptom from multidisciplinary perspective. The
exactly.
more we bring in different perspectives, I think we can address certain things, certain experiences better. Certain
Yeah,
like it, nothing is so isolated that we just look at it from one perspective.
absolutely. Yeah,
So that is why we have spent some time in the psychoeducation part, in explaining, busting some of the myths about the menopause, telling them what things are, and then really making the clients go through the journey of ideating hot flashes through the lens of psychology, psychological understanding. We also have touched upon certain aspects of night sweats also, because that's another question, that are they the same thing or they different?
yeah.
What is it that I'm experiencing? How will I know that this is not sweating due to
Yes.
anxiety or hot flashes or night sweats, or what exactly am I just feeling hot? And you really don't have many people to go and clarify this with, because I feel everybody is as confused as the other one.
Or you can go to Dr. Sukhpreet as well. Yeah.
Absolutely. I think that is where we need to understand that there are times when we should go to doctors and
Doctors.
clarify our things if we are
Yes.
stuck anywhere. And it's wonderful to have, Dr. Sukhpreet in our panel, who like when it's sometimes it's also the somebody who's understanding the interplay of different factors into it.
Yes. Yes.
So clients need to understand that there are different like things. If you really want to find an answer to something, go to the doctor. If you want to address something, come to psychologists, and
Yeah.
like this.
Yeah.
Coming back to the module again, the CBT part, I think it's based on the cognition and behavior aspect of it.
Yeah.
So what we basically are working on is what are the behavioral changes we can do to address the distress associated with hot flashes. So
Yeah.
our primary thing is about reduction of that distress. So there are techniques, there are relaxation techniques, there are distraction techniques. So those are techniques you can learn, strategies in your behavior. You can make those changes in your behavior, and that will help you in reduction of the distress. The
Yeah.
other aspect, however, is what maintains this distress. That is your thought process. If you don't change the way you are thinking, you will continue to go on with the dysfunctional thought, the dysfunctional interpretation, and the corresponding consequent emotions.
Yeah.
So the second part is a lot about understanding what your thoughts are, what the interpretations are, what kind of errors, we call them cognitive errors, what kind of errors you're engaging in the interpretation. And now that you know that there might be some errors, what to do about them? How can you
Yeah.
restructure them? How can you change them? And that is what we have tried to simplify and put step by step into, what are the things you, once you, how can you identify, how can you restructure? And once you've gone through the journey, I really like that space of, the social community where you can share with other peers, people who are,
Yeah.
it gets a
Exactly.
sense of community, and you can share it with others who are experiencing similar things. And
Yeah.
you can actually get a much more understanding and control over your symptoms.
Yeah.
So I think that is
Okay.
what it is
Yeah.
about in a
So,
nutshell.
thank you for sharing that. And also, now I'll shift to Angana. And how did, so when we approached you and we approached TherapHeal with this issue, what did you first think? And how did you go about designing the different, like this different things that Dr. Ananya talked about as well? So, what were your thoughts?
So first of all, thank you, Miyara, for bringing me to, or asking me, or making me the part of this module. So definitely, this is the first time that I have done something like as a digital program, because as a part of the training and as a part of the experience, it's always been like a face to face, whether it's a virtual therapy session or it's like a face to face. So it's
Yeah.
like for the first time that I'm part of something where I'm not face to face with the client, but I'm just designing or planning something very much ahead of time. So it's not very interactive, so it's very much new thing that I got to learn. So thank you for giving me that opportunity to to get another perspective of applying the cognitive aspect to the menopausal symptoms, and specifically one particular symptoms that we designed for hot flashes.
Yeah.
So it's something new that I learned, and thank you
Yeah.
for that. So, and adding to what Ananya and Nivedita has said, so it would definitely help us or help all the women who are going through the premenopausal, menopausal, or perimenopausal to understand these each of these symptoms, like for example hot flashes, not only from a physiological aspect but understanding from the cognitive aspect, like how do people interpret or think about one particular physiological aspect, the emotional aspect, like how do they feel, and of course the behavioral aspect. So basically they will learn from the four different perspectives: physiological, cognitive, emotional, and behavioral. So the program is designed in such a way that each of these aspects are touched upon and each of these aspects are being addressed, so that they can be particularly, like it's like a flow, like you understand the physiological symptoms, you know how to calm down, then you like as Ananya pointed out, like automatically it reflects to the emotions, and then how you behave, and how the distortions, if any of the women has, how that can be restructured.
Yeah.
So that way.
Yeah, thank you for explaining that. I just wanted to ask before telling you more about the program and going to Gayatri, Dr. Sukhpreet and Dr. Nivedita. So the treatment options, what the current treatment options for hot flashes, if you can just quickly tell us what they are, and it'll also give a good segue for Gayatri to explain why we decided to use this CBT based approach for hot flashes.
So just quickly, of course, there are nobody has all the answers. That's the first thing.
Yeah,
And the second thing is that menopause is multidisciplinary, multifactorial. Symptoms affect multiple organs, multiple systems. So it's not, there is no quick fix. There is no single answer to treating menopause as a whole.
yeah,
So we can go down each lane. And when we're addressing hot flashes, considering the basic pathology is considered to be estrogen deprivation or a decline in estrogen levels, the most logical approach is then replace that estrogen.
yeah.
है ना? मतलब iron deficiency है तो iron खा लो.
Mm.
Estrogen deficiency is take estrogen, but of course that has its own nuances, it has its own restrictions, cost factors. It's a lifelong thing. So even though it is great in many ways, it can be a lot of other benefits except your hot flashes, but it may not be accessible, it may not be indicated for everyone, and therefore sometimes we have to take the approach of managing symptoms piecemeal, that deal with the hot flash separately, deal with the cholesterol separately, deal with the mental health, deal with each one of them separately. So
Yeah,
that's like a different approach as opposed to take the hormones and get them get everything in order, which also doesn't work. So
yeah,
it still requires lifestyle and getting into better mental space. So
yeah,
that's one. Then comes a non-hormonal, which then you have over the counter
yeah,
supplements, which are sometimes can be scary because clinical research has not supported many of them. There's isoflavones, there's black cohosh, there's you name it, and it has been used. Evening primrose oil, omega-3, like hajar things, like you will just find so many of them, but we don't have supportive research.
yeah,
And then we have the non-hormonal, but then they are prescription drugs, so which
yeah,
I think probably Dr. Nivedita will be better
yeah,
well versed with, use of SSRIs, etc. But yeah, the CBT seems to be one of the methods or tools which so far at least has enough support with level 1 evidence
mm,
um, as far as efficacy goes. And I guess the more people over here who have more experience with it, I'm very new to it, but at the same time it seems to be one of the approaches which has been even supported by or spoken about by the North American Menopause Society in their 2023 statement. So definitely has great evidence to support it.
yeah.
So
Thank you
yeah.
for that. And Dr. Nivedita, as she said, non-hormonal drugs like even antidepressants or SSRIs have been, used for hot flashes. But can you elaborate on how that is used and how women take it?
Right. So I think typically SSRIs would not be my sort of go-to drug, simply because again, like Dr. Patel rightly put it, there's no one size fits all. That there's no one single formula. So coming from yes, SSRIs, which are predominantly antidepressants or used as antidepressants, anti-anxiety medication. Um, by their mechanism of action itself, they may help a certain population with hot flashes. So in that sense, they are useful. And because we spoke about a lot of people who experience anxiety or depression during this phase, so it can kind of be a cumulative thing. Like it can work for both, and hence a physician may pick up on SSRIs and prescribe it. But again, I think most physicians use a lot of caution. Medications are not the go-to. There are a lot of lifestyle or non-pharmacological ways that we can handle it, and CBT being one that's very simple to understand, and very effective in terms of and backed by a lot of evidence.
Yeah,
So typically I would say that we would go from non-pharmacological to pharmacological, and it's not the other way around, because at the end of the day, if with when you talk about pharmacological options, people have a lot of questions in their mind, which we do know of, with from our experience with prescribing it for anxiety and depression and so on, and rightfully so, because there are a lot of nuances, there are a lot of things to be considered while prescribing antidepressants. It's not like an isolated action
Yeah,
that it has. It works on your brain, and therefore it works on the rest of your body. But it is an option, but it is not. It would not be the first option. So I
correct.
think we'll have to go through a series of steps before we
Yeah,
reach that, and not everybody needs it, right? Because
yeah.
if you can work without medication, that would be the first option.
Yeah, thank you. Thanks for that perspective. So now coming to Gayatri, because we have designed the program all together, but I'll just start you off by saying CBT has been recommended by the North American Menopause Society as well as the British Menopause Society as a group CBT as well as a self-help guide. So what was our idea of developing a digital CBT program and reaching out to TherapHeal to help support us in this journey.
Yeah, thanks everybody for your input on this whole topic. So I think the design came about when we were trying to figure out how we can help women in this going through this perimenopause and menopause in a way as an adjunct to whatever the clinicians would give and do. So it is in case when the clinicians cannot give like medication, like Dr. Nivedita said, maybe that's not the first line. In case some women cannot take medication for whatever other reason, if they like we have heard after cancer treatment, they do go through and they can't take certain medications, like especially hormone therapy. So uh, in those cases, they need this, and there are a lot of women who do not want to take any medication again. So we were like, what can we design for them? And as you said, Sanjana, we came across these papers talking about CBT, and that was it. Immediately occurred to us, oh, we didn't know about it. So first of all, that was it was an education for us. We are like, what is this module? What does it actually involve? And it was great to see how it has been studied for menopause, for hot flashes. Thanks to Myra Anta for that. And we felt that it is a module that we could initially we thought, oh, so cool, we can just take it, and there's also
Mhm.
self-guide version of it. So we just take it and we make it digital. Um, and then we started, so we contacted Dr. Ananya about it, and we started talking, and we realized therapy is not as easy to make it digital. And I think Angana also might agree, because when we started discussing this, so we had lots of discussions on how will we make it effective in the digital format. It's not that you cannot make it digital. And I must say, there are a lot of other digital format versions of CBT based or using CBT techniques. Some digital programs are there. But we wanted to take it a step higher, where we try to make it as close to being interactive as possible, or at least a little more engaging, where you're still doing it on your own. We wanted to make sure that you get the most out of it by the kind of engagement there is. One, it should not just be reading and getting bored. So there is some level of, you have to do something interactive. Second is some audio guides to support you, to help you go through it, because you need some kind of to hear somebody tell you what you're supposed to do. So there is some audio guides also in it. And yeah, and thirdly, it is a full structured program. So it has got three psychoeducation modules and three strategy intervention modules, and it is interspersed, some of it. So, and you would be tracking your hot flashes through it. The person doing it will be tracking the hot flashes through it. So, I think it's very well. It has finally come together very well from what we initially thought, and we were very naive, Sanjana and I, that we can do this
We are,
in a few
yeah,
weeks.
yeah, we
And then
actually
when we heard,
conceptualized it in February. We started working on it, but it's now what? Is it September? Yeah. So
yeah,
finally we have it released for everybody because,
because we took time in making it more than just you read and do it on your own kind of concept, that it is something more than just that. And thanks to this team for putting it together. And yeah, that's what I
And
wanted to say.
one more thing I'll add is
Mm.
that group support and community support. So
Yes.
that's always there. So once people don't know how to deal with a certain emotion or don't know how to restructure a thought, they can always reach out to the community, the greater community, the group that is dedicated to each program. So they can ask their questions. We will also get the psychologist also to answer. And another feature is, if you're feeling triggered by the program, we you will always have you can always reach out to a psychologist through TherapHeal that we can make available to you. So we want to just help give access to more people with this program, and that was one of the reasons we developed it in this digital format. So just
Yeah.
want to add that to that. Yeah.
To add, yeah, like Sanjana said, the TherapHeal team, and even for menopause expertise, Dr. Sukhpreet is there. So we have this team backing us. So as you're doing the program, anytime you need support, a little more support, you would get that backing from this team that you see right here in this panel. So yeah, that's how it is. Anybody wants to add anything more? Uh,
Yeah.
yes, Dr.
Go ahead,
Sukhpreet.
Doug.
So just a quick one. I think it's just great to have something that you can do yourself sitting at home. So amazing. It's just amazing. Um, just what Dr. Ananya said about, you know, two things that suddenly came into my mind. Like um, you mentioned this whole think, feel, behave bit, and I feel like it's great if someone at the age between 45 and 55 starts thinking about this. It can percolate not only not to take care of your hot flashes, but into so many aspects of your life, right? As just the example that you gave, so many of us are still in that. We can be in that very saspahu mode where we are misinterpreting what someone else said to us, and our feelings and thoughts and behavior can really impact. So CBT perhaps can sort out a lot more than just the hot flash.
Yes,
But
exactly.
it's just as CBT percolates into the rest of your life, I think it can be great for just not hot flashes. Also, maybe someone who's never. I think it's great to let it percolate.
Techniques.
But having said that, it just immediately made me think of the other way around as well. That CBT is, as you mentioned, great for someone who has decided to go the non-hormone way, has decided to not take those meds. And I think, like, because menopause requires a multidisciplinary approach. Like it's like saying, if I take this one thing, maybe I'll solve maybe 5 problems out of 20. But CBT then looks specifically at your hot flashes and maybe the rest of your behavior around many things in your life, including taking care of your children or whatever else, that your in-laws or whatever else. So
Yeah,
I think both have their own advantages and disadvantages. And like, it's important to identify what is your menopause journey and then identify what works best for you. So just that bit, because hormones don't come without their problems, and CBT will not solve all your menopause related problems.
absolutely.
So I think
No,
that
I think that's a good perspective because exactly what we believe. I think CBT can be an adjunct to any therapy that you're doing. So if you're on replacement therapy or any kind of medication, you can also do a CBT program. It's just some people don't have a preference to take this or are not offered this option at all. So I think for these people, it can be very important to get the kind of help. And as you said very rightly, um, studies have also shown that the CBT program, whether self-help or group or digital or whatever, can also impact the rest of a person's life, right? So whether it's like you said, dealing with even sleep issues or just feeling in a better mood or just stress. And I think maybe we should ask Dr. Ananya and Angana and Dr. Nivedita to also talk about the impact of stress on symptoms and how CBT could help.
Angana, do you want, or
Angana, do you
Dr.
want to go ahead? Yeah.
Angana can go ahead.
Yeah. So as Ananya was introducing about the CBT, the concept of cognition or the way we interpret a particular situation. So, stress is a kind of response to a particular situation and depends on how any person is interpreting or making a meaning out of that situation. So, a lot depends on the type on that interpretation, and based on that interpretation, particular type of thought would come. So, whether that is a distorted thought or a helpful thought or an unhelpful thought, based on those thoughts the emotions would be impacted and the behavior or the actions taken based on that thought. So it's like that, it's all connected. The way we think, it influences the way we feel and the way we take action based on that. So it's like a vicious cycle. So whether uh, we are the stress, whether we are taking stress out of it or whether we are anxious about a situation, whether we are worrying about it, however we interpret, uh, the emotion is also dependent on the kind of thought or the kind of interpretation or the kind of assumptions we have based on a particular situation. Like for example, with respect to the hot flushes, like how a person is appearing, like how am I looking to my colleagues, or how am I getting the sweat and how other people are thinking. So a lot of mind reading can happen, a lot of jumping to conclusion can happen, a lot of this can lead to a lot of catastrophizing about the situation, and can be overgeneralizing, like okay, today I have appeared like this, maybe in the next couple of meetings I'll avoid going to any meetings because I would have these kind of responses. So a lot depends on the situation the person is, and the next step would be how the person is interpreting the situation, and based on that interpretation how the assumptions are formed, how the negative thoughts are coming, and based on those type of negative thoughts, the emotion like the stress, worry, anxiety, or apprehension. So based on that the person would take the action or the response, like withdrawing from the further situations
Yeah,
or from
yeah.
the similar meetings or
Social
similar
situations or
situations. So it appears like a vicious cycle.
Mhm.
So that can be explained, or the program can help people to become more aware, like most women are little negligent about their own health. So when it comes to their mental health also, it's also in the background. So this way they can also get to know a lot about things that they may not be so much aware of. So they
Yeah,
can start accepting that okay, so along with the physiological aspect of menopause there are also cognitive aspects associated with it, and a lot depends on the type of the way I'm interpreting the situation. So
yeah,
it can help in restructuring the way they are thinking or modifying the way they are interpreting the situation. Of course it's not a one day task, or of course
yeah,
it's not a 4 week task, definitely. So it needs a lot of practice, it needs a lot of consistency, persistence to keep on practicing the way they have learned through self help, like okay, this is the way we can restructure the thought, or this is the way we can interpret the situation in some other perspective. This is one way of thinking. So what is the alternative way of thinking? What could be the more my next plan of action if this today I if something like this happened and I'm thinking in this particular manner. So maybe in the next social gathering, are there any other ways that I can prevent that, or that I can take some better way to deal with it. So it opens up the way we think, not as a one directional. It's like it opens a multi-directional way of thinking or taking perspectives about one particular situation.
yeah. Thanks for sharing that. And actually, there have been people who've come to us and who've like withdrawn from social situations just because of this. So I mean, imagine if we had the tools to give them, or empower them with these kind of thinking and tools at that point, where they didn't have to suffer through that isolation as well, not only facing the symptoms but also the isolation, right? So I mean, these are really powerful tools, but I'm just wondering, from the psychologist and the mental health perspective, is this not for some particular set of people? Like, who is this like program designed like this not for? I think it's important to also address that. And Dr. Sukhpreet, also feel free to add.
I think one of the things that we need to understand, and this is a general limitation of a digital program, that we are not talking to a mental health professional directly. So, what that misses out on is we cannot directly see the client, assess the intensity of the client, and see whether there are other things. Like, for example, if a client is having hot flashes, at the same time also having suicidal ideation, and expecting a digital program to address both in some way, and trying to also, trying to make sense of what the program is providing and implementing it for the other, as the suicidal ideations also, then it may not work. So some of the contraindication is also the severeness of the experience,
Yes, exactly. Yeah.
and how severe it is, the severity of the experience. And of course, we do not recommend this for any client with any psychotic illness. So if you are experiencing anything like hallucinations or delusions or anything that distorts the reality, suicidal ideation, if you're having, and I'm saying ideation, not even going beyond that, like if you're even thinking of something, then there might be comorbidities. The other thing that we need to understand is it's not an isolated experience. You might be having this along with some other psychiatric comorbidities, and then this kind of approach may not cover everything and may not be suitable also. But
Yeah.
if I have to summarize, anybody with any kind of psychotic symptoms like hallucinations, delusions, any severity, like if it's very severe and you are really trying to, I would suggest try and see a therapist one to one. Digital programs are self help programs that can probably address any symptom from a mild to moderate
Yes,
severe.
and I think that's what we say. Please, if you have severe symptoms, you need to consult a gynecologist, a mental health specialist, a psychiatrist, or a therapist. So that is one of the things that we suggest as well. Dr. Nivedita, do you want to add something to that?
Yeah, if I may add to what Dr. Ananya said, I think we have to look at it as this is not, like she said, this is not therapy, right? So, although we're calling it a CBT module for hot flashes, this is not cognitive behavior therapy in the true sense. This is using the framework of cognitive behavior therapy, or the techniques that are essentially a part of cognitive behavior therapy, and digitizing it and making it into a module for a particular symptom, right? So in terms of who this is not for, like she rightly mentioned, people with severe mental illnesses, I would also put in a word of caution and say that if you are somebody who has a pre-existing mental health condition, and you're going through menopause, then I would err on the side of caution, and probably see a therapist, and run it by them. This, and if they're okay with it, go ahead. Or you can always, you have the option of going directly to your therapist, right? And this is not for somebody with severe problems or somebody with other psychiatric comorbidity,
Yeah.
right? But at the same time, I'd like to add that the beauty of this module is the fact that it is so simple, right? As somebody who's been there from the inception, and I've been through the completed module and so on, and I can vouch for the fact that it's very simple. And the beauty lies in both the fact that CBT as a model itself is something that we can all apply in our daily lives, right? You
Yes.
don't actually have to have a problem or an illness for you to use CBT. CBT
Yes.
just works for a lot of problems, for a lot of things. It's a good tool to have at the end of the day.
Yeah.
The second thing is, a lot of us, me included, I think we have sometimes have a reservation about, say, seeing a therapist or seeing a psychiatrist, or you don't know when what is okay. I'm feeling a little low. I'm feeling a little down today, versus what is depression? What qualifies for depression, right?
Yeah.
So I think this, so there is this hesitancy to seek that kind of help. When do I see? So at what point do I have to see a person, a qualified professional, for my, say, hot flashes, right? Or if you're somebody who has reservations about going up to a therapist and discussing this, I
Yeah.
think this can be an introduction, something that can ease you into the process, right? And therapy is not often complicated. It's not a daunting task, and I think that is something that we've tried to sort of bring about in this module. um, I think at TherapHeal we've tried very hard to work very hard to make it simple to understand, right?
Yeah,
um, and simple so that everybody can use it regardless of your
access.
background,
Yeah,
and also diverse in its application. So that is perhaps what is unique about this module and about CBT in itself. So I think these two are the things that I would go with.
thank you. Thanks for adding that. Exactly. We want to give more people access to these kind of techniques. Dr. Sukhpreet, final I have word from you and then the whole panel. But first, question to you is, when you have severe hot flashes, what should the next step be from, from a medical
Find
perspective?
some space in the freezer.
Apart from that.
It's an awful feeling to go through repeatedly when it disrupts your work, when it disrupts your sleep. So what should one really do? I think discuss your options. That's the best thing that you can do, because you have 50 options actually available in front of you, some of them evidence backed, some of them not. The point is getting that information. Don't jump into any one of them without thinking. Like, don't take anyone's word to just hormones will help, just that will help. Put them on the table, figure out which path you want to take. And as I keep saying to all patients and all women, you don't have to get married to it.
Yeah.
Because today, if you decided to go down a path, it doesn't mean that you're stuck with it for the rest of your life.
Yeah.
Yes, you can detach from it and change your mind. Changing your mind is an option.
Yeah.
So, no hormones, I fluctuated from no hormones to hormones, and who knows, I will stop hormones at some point in my life. Who knows? And at the same time, like, I feel like if you decided to go soy isoflavone or CBT way, it doesn't shut your door to the next treatment option. So that's one thing to kind of keep open, that there is no binding yourself down for life. Nothing is permanent, including your approach to hormones and your approach to menopause per se. Forget hormones. So that's one. But this about this using CBT and this whole severity bit, like I like to use the analogy कि जब भी severe UTI होता है, then you decide there is a time to take antibiotics and there is a time to tell someone just have lots of fluids.
Mm.
So yes, when it is severe, take the antibiotic, but you've got to move on in the future with taking a lot of fluid, and you can start them together. So antibiotic will work for 5 days, and then for life you can continue with just
Yeah.
having a whole load of fluids. And so maybe there is a time for saying this woman needs drugs right now to just help her pull herself out. Because to do CBT also, if I tell someone go exercise, वो मन भी तो होना चाहिए ना, my mood is only so low, I'm in
Yeah.
quicksand, I need someone to lift me first.
Yeah. To
So,
then do the exercise. Yeah.
so conventional medicine has its advantages. It has failed in with many respects all over the world. Globally, it has collapsed in many ways, but it does have its place in pulling someone out when the time's right. And then lifestyle and other measures can easily take over and prevent them from going back into the med zone again. So again, depends on severity of
Yeah.
someone's symptoms. But I think that this whole thing about psychology and taboo for the Indian woman, especially, according to me, everyone needs a therapist, because there is so much room for introspection and improvement, and just seeing your own perspective is so narrow. Ek hi to zindagi hai, matlab at least get someone else's perspective on it. So or help yourself think. So but with respect to women, and especially Indian women, the option of going to a psychologist is looked down upon, and is difficult, for many reasons. And I think this digital program is something which gets rid of that hurdle.
Yeah. That. Oh, yeah. Exactly.
That sitting at home, nobody needs to know that I
Needs to-
entered with of course online programs. I'm sure you guys have maybe also a great option. But yeah, so that's my two takes on this.
Yeah, thank you for saying that. But it's so funny because mental health is health. I wanted to add that's a sticker that you see on Instagram a lot. But actually, while I was, creating, ideating, and then helping, put together this program. I was just telling Gayatri yesterday or something. I was like I feel better because I've learned now the techniques of cognitive behavior therapy, which I would never be exposed to otherwise. I was like, I know now how to reframe my thoughts, and I can think of another perspective. So it can help you in all aspects of your life, I would say. So yeah, so whether it's our module or whatever else you choose, I think it's a great place to start, like Dr. Sukhpreet said. But now finally I would like to go around.
Sanjana, just sorry, just 1 minute. I'm going to interrupt you there. You said mental health is health. I would like to add mental health and sexual health is health.
Sexual health also.
Nobody's paying attention to sexual
We're
health as
going to
well.
come up with a program soon on that, so stay
Yes.
Great. All right. Sorry to interrupt.
tuned. Yeah. So would like to go around the room, and Gayatri, if you want to add something before that, or maybe
Yeah,
Patel.
so I just want to add about the program itself. Main a few things. One, like Dr. Nivedita said, it's a place to start wherever you are. Because we also there's a psycho when we said psychoeducation module, what is a psychoeducation module? It is where you are understanding what menopause is, what hot flashes is. And we have kind of simplified it, but it makes you understand, okay, this is what I'm going through, which itself is part of reducing the anxiety of what is happening. So I think that is something that I would say everybody has put it out nicely that this program is some place where you can start for your mental health further. So, and I just want to also talk about one of our customers. So we did give it to a few people to try it, who were people we have had of many people like over the last 2 years, as Sanjana pointed out, who have told us that they've gone through hot flashes. This is another reason we actually created the program. We had somebody who said she was in the board in a meeting room full of men, and for the first time she had her hot flash, and she didn't know that that was what was happening to her. She didn't know what it was. We had somebody said they left jobs because of hot flashes because it started nobody was being understanding or supportive at her workplace. We have had people come at different situations, like social situations. Somebody said somebody stopped going to parties. She said, can you help me? I've stopped going to parties because I don't know when this hot flash is going to happen. And this is what triggered us to start it. And here we have one of our people who tried it, who has given a beautiful review. And she said, I tried the Miyara CBT program for hot flashes and can vouch for it really. The techniques have clearly helped me identify, understand, and manage my hot flashes better. So that is her review. And she not, and this is what she's right now put on the live chat.
We've
But
not
she
planned
also
it
has
yet.
told us before this that it has also helped her social situation at home because, like we have been discussing this technique, she started using it for her daily life, and it has helped her. The whole family situation, social situation, it's helped her deal with a lot more than just hot flashes at this point. So I would like to just I'm from my side end with that it is really helps, and we have an offer in place 50% till end of September. So go to our website miyarahealth.com, and you will be able to there's a programs page, so you can see it in the programs page and take it up. Yeah.
Yeah.
Anybody
And
else wants to add?
and yeah, please, last words from all of you, Dr. Nivedita
Yeah,
or Dr. Ananya.
yeah, I think I'll just, yeah, Nivedita, go ahead. Go ahead. Okay.
All right.
Uh,
Okay. Just one bit. I think we've spoken so much about menopause and how it's an individual journey and all of that. But I'd also like to take this opportunity to say that um, you know sometimes this whole process or any such transition can feel very isolating. When you're in the midst of a hot flash, it can almost feel like, oh, why is this happening to me, or is this happening only to me? And I love that the package, the module that we've designed can help, not only help you understand that you're not alone. This is quite common, it's happening to a lot of women. And what we mean when we say that it's an individualized treatment or journey, it just means that the way you it just means that it's happening to everybody, but the way we approach its management would be individualized, right? It's not that it's happening only to you, it's happening to everybody. But
Right.
our approach is, it takes into consideration you as a unique individual, and that's how we'd like to help you manage it.
Yeah.
And also the fact that there is a kind of a space for people to come and share their experiences, which I think also the platform allows. I think that's a nice thing. That's a safe space for women to come and discuss this. And while women's health in general is being addressed these days, at least a lot more than what it was a few years ago, menopause is still not something that's so openly spoken about, and oftentimes it's a bit of a taboo. And I love that, that there is Dr. Sukhpreet and on Instagram, and there is Miyara and all of you guys who are doing work in this area. I didn't know until our interaction started that there were people working with menopause. So yeah, all the best to you guys. And
Thank
it
you.
was wonderful opportunity for me to meet all of you and get to know about the work that you're doing in this field.
Thank you.
That's about it from me. Thank you.
Dr. Ananya?
Thank you. In continuation, what Nivedita was saying, when I just remembered around many years back, first time my mother was experiencing hot flashes for the first time, and she didn't know what was happening. But I recall she called up my aunt and she lowered her voice over phone, and she was like, "You know what? I think something is happening." And there's so much shame associated with it that she could not really ask her, talk to her openly about it. And that is what I've seen around. There's a lot of shame, lot of, something terrible is happening, something terrible is ending.
Yeah.
Conversations like this therefore is so important. I recently watched a series called Bombay Begums where we saw
Yeah.
Pooja Bhatt experiencing that. I
First
was so
time.
glad.
Yeah.
Yeah, I was so glad that they are now showing it, and this thing that I am not alone and it is not something to be ashamed of actually addresses the stigma not only around mental health but the stigma associated with women's health also. How often do we talk about it? So I think this is just the beginning. The program will therefore not only help you understand yourself better, but also accept yourself, your health, your journey better. And it's a very simple program, but the simplicity of it can actually impact you, look at things and break the stigma associated with it. And probably this can have a snowball effect. One person can say, why don't you try it? And that way we can actually build a larger community where we are talking about it openly and helping ourselves better as women and as professionals. So that's it from my side. Kudos to you, Miyara team. We love the journey. I also learned a lot of things during this process. So all the best, and
Yeah.
let's hope this program works.
Doc- Angana, would you like to add something as well?
Yeah, I think every point has been covered by Nivedita, Ananya. But one thing we can remember, like, 4 points usually I tell to my clients regarding like how you are progressing. Like there are many, tracking. Self assessments are also included in the program to help you know little quantitatively like how you are progressing for each week. So maybe you can keep a track of the duration, intensity, frequency, and the impact on your social, occupational, personal, physiological health. So, as Sanjana, I asked you asked earlier, right? Like who the program is not suitable for whom, like. So
Yeah.
maybe people can assess in that way in those four domains like duration, intensity, frequency, and impact. And
Yeah.
based on that, after they start taking the program, they can assess each week like how they are progressing. So in that way it's not only qualitative or not only subjective, but it's also becomes gives them a graph of a little more objective and a little more quantifying self feedback, because CBT is also, or cognitive approaches are also very feedback oriented, so
Yeah.
it's evidence based.
Great.
You get the evidence on your own, so that's how the self help programs can help.
Yeah.
So, of course, thank you for giving me the opportunity to be a part of the program. I really learned a lot about digital programs, and all the best to all of you, all of us.
Yeah, all of us. Yeah. So thank you, first of all of you for being here. It was such a pleasure talking to all of you. I love the fact that we could all get you all in this little virtual room and discuss menopause and hot flashes from all these different aspects. As we said, we have this module was created with Miyara as well as TherapHeal, and we have Dr. Sukhpreet as a great advisor as well to us. So please make use of this simple module, and we have a special offer running. And thank you all for your time, and looking forward to more such conversations where we open up topics about menopause, mental health in different ways, and hope to work with TherepHeal as well again. Thank you.
Thank you.
End the stream now.
Thank
Thank
you.
you. Thank you.